Good afternoon, everybody. Thank you for joining us and who just joined us now. The webinar will be starting shortly. Please be aware that it is recorded and will be shared publicly afterwards. Good afternoon, everybody. Thank you for joining us. I think we'll be ready to start. Just admitting the last few people in the lobby. And then we'll start with you. Good afternoon, everybody. It is my greatest pleasure to be hosting this first of LEAP webinar series this year. During our webinar today, we hope to provide you with the context and the background to this primary care placement pilot SLICE, student-led integrated care environment. It is a third-year nurse-led clinic utilizing the annual health check for patients with learning disability in primary care. We will be highlighting why this is important to our wider system at Humber and North Yorkshire Integrated Care Partnership, the ICP. We hope to offer an overview of the supervision model, the journey, the lessons learned too, and of course leave you with some contact details to support any future initiative you might consider and you think we might be able to support you. There will be some time at the end of the webinar to take any questions you're posting in chat, so please do so. And if we run out of time, we will be collating all of these questions and make sure that we answer them and post them to you post the webinar communication around 2 weeks from today. My name is Hanan Harb. I'm one of the LEAP project managers working together differently, hosted within the People Directorate at Humber and North Yorkshire Integrated Care Partnership. I'm delighted to introduce you today to my colleagues Debbie Cross and Gemma Hodge, who are project leads for the CPEP, the Clinical Placement Expansion Project, and are the peripatetic educators. Contact details for all of us are included later on in the slide deck, should you wish to get in touch, including hyperlinks to our Twitter and future NHS platform. Please do tweet us, hashtag SLICE, and accounts to the lower is available in the lower of the slide. And share information about anything that stands out for you from today. We would love to hear from you. Before I provide you with a brief overview of the LEAP program, I thought it would be helpful to clarify the role of the integrated care system and why this particular project is of strategic importance to us. Apologies to those attending who are already familiar with the integrated system, also referred to ICS. Our health and care systems are partnership of organizations that come together to plan and deliver joined up health and care services and work together to improve the lives of the people who live and work in their area. Humber and North Yorkshire Health and Care Partnership are one of the 42 statutory health and care systems now established across England. We are one of the ICS within North East and Yorkshire region, and we have 6 places within our geographical footprint. The Humber and North Yorkshire Health and Care Partnership have recently refreshed their integrated health and care strategy, and this slide outlines our ongoing ambition to improve the lives of our residents and to increase their life expectancy. It is underpinned by the Health Foundation building blocks of good health, and our vision is for all people to start well, live well, age well, and die well. We have set intentions to achieve this vision, which focus on creating the right condition within the ICS that will change, empower, and enable our residents. Like we need to think person, enabling people to live healthy, independent, and save lives for as long as possible, understanding what matters to them rather than what's the matter with them. Think family, supporting families to enable everyone to be safe, grow, and learn, and that every child has the best start in life. And think community, by being all-inclusive through a community approach that ensure that next generation are healthier than the last and have the opportunity to thrive. So LEAP stands for Learning, Environment, Assessment, and Placement. It is a time-limited NHS England programme established within Humber and North Yorkshire since 2020. Health Education England, as it was used to be called, a main aim originally was to increase practice-based learning opportunities for pre-registration learners in order to meet our national workforce ambition. Despite this, our primary stakeholders group agreed from the start at this program that an increase of in practice-based learning opportunity would be more likely to be an incidental output of our projects. This is because placement expansion is more complex than just opening up a new learning space. This allowed us to adapt our strategy, and our ambition has always been to fund and develop interventions for any learner, and to also make sure that our existing workforce will be included within the definition of learner. We have a LEAP strategy and delivery plan. We are supporting the delivery of 3 strategic priorities and 5 objectives outlined on this slide. Our priorities are all based on the call to action within the NHS People Plan to grow our workforce, to train our people, and to work together differently. The LEAP program is effectively an enabler, providing funding for proof of concept pilots that can be sustained and reproduced at scale beyond the life of LEAP. You can find out more about the program by following the links to our web pages and our Future NHS platform. For now, however, I am so delighted to hand over to Debbie and Gemma to share information about their primary care placement pilot slice.
Okay, thank you, Hernan, for that introduction. And thank you to everybody who's attending today. Gemma and I really do appreciate that because, as we all know, time is a very expensive commodity these days. So I'd just like to introduce this in terms of what the flow of the session will be like today that Gemma and I are going to present. First off, I'm going to give a little bit of background to supervision and assessment models, just as an update about what the project was about. Gemma then will come along and give the journey process that we went through. And then both of us will come together just to tell you about how we feel our role is evolving as a peripatetic educator and where we might be taking that to. Next slide, Hernan, please. Okay, so what is it all about? Well, basically Health Education England, in partnership with Coventry University, they funded a pilot they did to have a look at learning disabilities and running a primary care clinic that was nurse-led and that would have an impact with the annual health check or review. This was part of the transformation process and part of the CPEP, or the Clinical Placement Expansion Programme, and it was hosted in GP practices working within the NHS Community Services and Social Care and other independent providers. And it was to help to have a more coordinated and proactive with our services. And the focus was generally on the learning disability care aimed at promoting high quality active living for this group of people. Next slide. Thank you. Well, as we all know, the challenges around clinical placements, we all know that the fact is they're few and far between, and they are at a premium, and no more so than for specialist training in particular. There is a continual need nationwide, but also particularly here in a cold spot of Humber and North Yorkshire regions, that we need to expand our placement provision, and particularly within private, voluntary and independent sectors. When using any clinical placement model at all, in order to help this, particularly with undergraduate health professional education, what we want to do is to foster very good positive perceptions about the experiences. And that's not just for the student, that is all for the partnership that we deal with as well too. And that supports development on both sides. And particularly in this pilot, we wanted to look at the self-efficacy and the confidence and the skill development that could come about from this pilot. And they were the key sort of metrics that we wanted to have a look at. Next slide, please, Hanan. Just in a sense to recap a little bit, for those, I know probably most of us are quite aware because now this Supervision and Assessment Standards Part 2 of education and training has been well underway. It has been. And previously we were aware that before 2019, there was a 40% levy of actual contact time, which was undoubtedly becoming unrealistic and unsustainable. And it did not fully encompass the student's exposure to the full patient's journey through an episode of care. And had to be an appreciation of other care professionals that were involved within that journey. So one aim about this change was to give nurses an appreciation of the complexities of navigation of that journey, and also to understand everyone's contribution to that care, but particularly to highlight the magnitude of nurses' participation within it. Like all standards, it wants to recognise the professionalism and to safeguard the public, and also to deliver high quality to care. And in particular now these days, with the complexities of care, is for it to be bespoke. The new standards projected the limited and pressured mentor role into a new dimension, and it was meant to be more fluid with the introduction of supervisors and assessors and academic assessors, and to take full advantage around activities and to alleviate the pressure on the assessor responsibility. However, the issue now, has probably previously been stated, that placements and assessors are still at a premium despite these changes. And one reason being is unfortunately we've had the advent of COVID. And this undoubtedly had a two-sided sort of effect to it. We did see an attrition, with our qualified staff, but we also saw a big increase in placement provision and also for the admission of trainee nurses. So NHS employees and HEIs have therefore looked closely at models of supervision of how they can effectively manage and increase nurse training numbers with a limited amount of nurse assessors that we have. Despite that, knowledge of skills can be imparted, particularly now that the fact that we have blended learning, we still have students that are still highly anxious and concerned about making their transition from being a student to being a qualified practitioner. Equally, the revised curriculum does require third-year nurses now to undertake some form of academic training around becoming an autonomous practitioner. But in light of the pressures that we have within clinical practice, this is becoming increasingly challenging. Therefore, what we are finding still now is self-efficacy, confidence, and motivation is to a degree still limited. And there is still that heightened anxiety amongst third-year students going into practice. Equally, in light of the pressures that we are finding within the NHS, preceptorship periods of post-qualification is quite a challenge, and that there's probably only a small allowed lead-in time for that newly qualified member to become fully work at an optimum level. This has shown from statistical analysis that within the first 5 years, as we do know, we are likely to see a lot of attrition as a result of burnout in newly qualified nurses. Therefore, we must turn our emphasis of how we address the root cause and put in place models of supervision that will not only enhance confidence and self-efficacy, but also the motivation, and to look and test students' resilience, autonomy, and knowledge, so we can close the gap of passage from the student to qualified practitioner. Now, equally, we wanted to focus on learning disability nursing in particular, because we felt that it hadn't had a sufficient high profile and focus on expansion of their training placements to give them those essential healthcare, that central healthcare discipline, a higher emphasis, and particularly the special need and the skills required to play a role in primary care. Next slide, please, Hanan. So firstly, Gemma and I had to really think about was, although that we had the metrics of looking at self-efficacy and confidence, which was our main aim, we had to first look at the motivation of whether general practice had an interest in investing in LD nurse-led clinics. And evidently there was some degree of apprehension. Now, Gemma will focus on that in part of our journey. So our metrics were very clear about the facts of self-efficacy and confidence that needed to be, in a sense, measured, but not just for the student, but also for the assessors as well too. who are involved. From our provisional research so far, we have found that there is an increased confidence that is actually helping by using a long arm approach that we have done. And this backs up considerably in terms of the fact of what Bandura terms as being evolving role identity and also a sense of value in the work that we undertake. So we have found that workforce well-being has been alleviated, and particularly when the LD students were undertaking the QOFs around the annual reviews. We have found from the reflections and the analysis we've done already that there is student autonomy is working quite well and preparing the students well. We've also found that increased practitioners' confidence using the long arm supervision has increased. And we also know that there is transferability with this model that we can do to other healthcare disciplines. But the most important part of all is that working with our partnerships, particularly our stakeholders, we have seen a marginal increase in quality patient care, in particular by introducing LD students into this. Next slide, please. So I just wanted to think about is the models of supervision, and this is accessible through the NHS employers, and probably some of you might have seen them. So I was keen to ask you as an audience whether any of you have probably utilised these models of supervision, whether consciously or unconsciously at all. And I just wanted to give you a moment to have a think about that, really. And I didn't know if you were possible to put in the chat, some of you actually have or not. Has anybody managed to have a look at that? Never mind. Probably not. It's okay. No problem at all. But these are the most common forms of model supervision that are actually used. All right, some of you have. Great. That's fantastic. So we've got synergy long arm. Absolutely excellent. Long arm assessment. So already brilliant. People are using it out there already. That's fantastic. That's great. Gives me an idea where to pitch it as well too, actually, with this. So what I was sort of thinking, Gemma and I were thinking, is when we were actually undertaking this pilot in particular, is whether some of you had considered probably a more integrative approach as well too, particularly those who've used long arm. Yeah, someone's absolutely covering all of these. This is fantastic. So I didn't want to actually teach you all to suck eggs on this part because it looks like most of you have been using these quite significantly. And these are the ones that have been most effective, I think, since post-COVID or previously before, actually, to utilise. That's fabulous. Great. And some of them actually are integrative, which is fantastic. That's great. Okay. So most of you do have a good knowledge and background about these. And what Gemma and I are going to be focusing on was predominantly the long arm and probably a 2-to-1 dyad, and what our experiences was in terms of running these clinics with third-year students. Okay. So that is fantastic. I don't have to overly probably extend this slide to go into each one. I think most of you there have. And as I say, to those that haven't, you can access on that on NHS Employers, which goes to it in a little bit more in depth. Well, as most of you know, that the long arm approach for the supervision does refer to the process of supporting students in placements in line with the professional body requirements. It does. And the model requires a supervisor to be located at a distance for the clinical practice learning area and be available for support for the student. It means that long arm practice supervisor doesn't necessarily always have to be there on a day-to-day basis either, as we do know that, but a named member of staff will be around to help if there are issues that are potentially raised. I mean, as we all know, it offers the student in particular a chance to work independently and in placement areas that don't necessarily have a registered healthcare professional. And that's, for example, probably social care, but undoubtedly gaining some support at a long arm. So the long arm supervisor will discuss a learning plan, and we know that this is something that Gemma and I did find is that the learning plan in particular, setting up the process of placements and also the learning plan is essential in this part. And this is so it sets out very clearly what the expectations are for all members involved with the long arm approach. But undoubtedly is that it allows probably the assessor in a sense to assess that student's competences from the afar and getting feedback from other supervisors. So it's fantastic. Great. That's great that the fact people are doing that already. So if I can just go to the next slide, please. Well, who can sometimes help you? And probably some of you have already actually have found help through this, either through your HEIs or probably PEFs or whoever that you have. But as we are now, we're in an area of expanding roles, particularly, or this expansion roles. And nurses in particular are increasingly employed as what we call boundary spanners. They are. And they have the ability to connect patients with services in health and community settings. And this is equally true that Gemma and I were finding in a sort of emerging roles, certainly in primary care and education and development. Now, I'm sure some of you, I looked at the delegation list, as probably some of you are very familiar with some of these new development and expansion roles that they're being undertaken at the minute. So the legacy mentors in particular, you know, about the fact that they are people with a longevity within the profession, and through experience, they have, and trial and error probably, that they can offer a lot of coaching and mentoring, pastoral support, and in particular, probably to newly qualified individuals. They do, and probably also be utilised probably for third year led clinics as well too. The other thing is I was at a meeting a couple of weeks ago, and in the South Yorkshire region, there is now beginning to be the implementation of the practice educational leads, or the PELs now, and they'll be upscaling a lot of skills. They will be with the GPNs because they're a little bit behind because of COVID. They take care of the VTS programs, and evidently there is ongoing training through triple SA guidance. There will be, and what we're hoping probably is to see more of those roles evolving, of where probably each PCN maybe have somebody placed within that role to help out with helping with placement expansion as well too. Another is associate lecturers, and I think it depends. Those of you probably in HEIs in particular, they usually are educationalists, or they are individuals that straddle both HEI and clinical practice, and they have the specialist knowledge around placements provision. They do, and they're very good to access, and particularly if they are related to primary care. My own experience, I was an academic in practice a few years ago, and part of that role was very much in terms of ensuring audits were updated, students had a satisfactory experience, development for staff, making sure that the fact that triple SAs were undertaken, and also helping out with PAD documents as well too, and initial, midway and final assessments. And then there comes to Gemma and I, very much a new role indeed. And I think as we're finding, it's beginning to evolve very much like a PEL in particular, but the focus has been more on probably research and development because it's a pilot study. And we have been finding that we have been more of an outreach service to those areas where communities in particular may not have such access probably to PELs or legacy mentors or PEFs at all. So in light of that, just given the background to it, I am now going to hand over to my esteemed colleague, Gemma, who is now going to take you through the journey of what we did in terms of the long arm approach with annual health checks.
Thanks very much, Debbie. Can you hear me okay? Yeah, that's fine, just checking. Right, next slide, please, Hinam. So when we first started this whole project, there was a lot of talking. We could do this, we could do this. We had so many ideas. And then we realised what we needed to do was stop talking, start doing. So we liked this quote, it sort of summed it up. Next slide, please, Hinam. Thank you. So the challenges, I thought I'd start with this bit because this is one of the key parts of how our project came about. So there were a few things. Networking. a lot of people, when we were networking, because we came into this cold, we didn't have many links in the area, they were interested, but they all said, we're really interested, but can someone else do it first? And that was a real challenge for us. And one way we tried to get around that was we realized by creating a package, which was basically some slides, basically selling ourselves, showing the surgeries what our vision was with this student-led clinic, and how we had this vision of a triad of what the student could offer for the GP practice, and the student could offer the placement and the patient, what the patient could get out of it, and also what the GP practice could get out of it. And those three things together in our package were sort of part of the way that we could sell this to some of the GP practices that were maybe more reluctant. Linking in with that, one of the other issues that we found a challenge was that getting enough qualified assessors who were willing to take part in the long arm approach. There were some fully qualified assessors who had quite a lot of reluctance to engage in this long arm approach. And, you know, despite trying to influence that and encourage that and educate them, it was an absolute no-go, which is fine. And then on the other side of that spectrum, we had people who were really eager to be part of it, but were not qualified as assessors, or were not up to date with their training. So in mine and Debbie's role, we were able to support them in developing and accessing that training to either update them or get them through that SSSA training so they could be an assessor going forwards. Estates and infrastructure and on PAR. PAR is like the placement service that we use. There's a couple of like ARC and a few other different ones, but basically this was a challenge where we had to make sure that the places that we were looking for had the infrastructure, had enough space to put students to start with, and that they were assessed and that they were audited so that they were already deemed to be safe for a student to go to. And if they weren't, that was part of the process in order for us to make sure that we'd done all of that so that it was already in the timeline that we had that was quite tight. A huge challenge we had was the timing of the placement for our students. Our students don't go out until the end of January and until the beginning of April, which, if you're familiar with the QOF year, the financial year, a lot of these assessments that our students were going to be doing, which were the learning disability annual review clinics, were done because the GPs needed them to be done in order to get paid for them by the beginning of April. So this was a real big challenge for us trying to get in there. What we wanted to do was we wanted to create learning opportunities to foster not only the student autonomy and self-efficacy, but also in the staff members, as Debbie alluded to before. So this was something that was our challenge in how we developed this to make it meet those needs. And then something that we'd thought about when designing the placement was that we didn't want it to be monotonous. It had to meet a number of things. It had to meet the students' proficiency requirements for that placement, which just doing a student-led clinic every single day would not achieve. But it also had to be interesting. It had to provide learning opportunities for them. So we wanted to look at how we could make it fit the needs of their placement requirements for proficiencies, but also give them a really interesting, diverse placement that would stretch them. And then thinking about all of it, it was about making sure it was a really diverse, rich experience where it enabled them to consolidate their skills, thinking these are final year nursing students, they're going to be out qualified very soon. Next slide, please, Hanam. Thank you. So the key placements and participants. After networking immensely, we identified 2 primary care surgeries in Humber and North Yorkshire. We also identified 3 spoke areas that we wanted our students to go to enrich their placement experience. We linked in with the Wilf Ward Trust to do some initial experiential work on identifying what people with learning disabilities want from an annual review and what they're already getting, and use that to focus our plan on how we were going to ask the girls to create it. And then we had our 2 lovely students, Charlotte and Carla, who were our two placed students. The spoke areas that we identified were the Full Sutton Prison and going with Tuve, which was running some antipsychotic clinics. So it's another student-led project, but only 1 day a week. The prison, the girls got to go to for 3 days during the 10-week placement. And then the other placement was a mental health ward, like an inpatient ward. And the idea being that by going to those areas for a day a week or randomly over the 10 weeks, they would get that experience to enrich everything that they've learned and develop their skills and build their confidence, hopefully. Next slide, please, Hanan. So the timeline for the project implementation and evaluation, we had 6 months, and in that we had to basically go through 1 to 5. So I'll just briefly go through each one of these with you and answer any questions at the end. Next slide, please, Hanan. So the first thing was preparation. This was the massive bit. The challenge was finding 2 primary care centres that were willing to take part. We also needed to identify our students and brief them on what our objectives were and our expectations of them were from this whole project. And we, again, this is where we were already thinking we wanted this hub and spoke model where we had the key base area being in the general practice to do the student-led clinics, but they had these other spoke areas where they'd go out and get this extra experience to make sure that they were fulfilling not only a general practice's QOF, but actually meeting their proficiencies and feeling like they've learned an awful lot and getting to use their skills in many different areas whilst focusing it all around a student-led clinic in learning disabilities. Next slide, please. Thank you, Hanan. The second stage was briefing, training and implementation. So this is where we consulted the practice assessors and we looked closely at how the learning objectives within the PAD could be achieved. We mapped all the proficiencies that they needed to meet in this placement to what they could achieve within the placement during the student-led clinics. And then we made sure that's where the spokes came in, basically the prison, the inpatient setting and the antipsychotic clinics came in to make sure we met all of those things for them and made it a really rich experience. During this time, we were clarifying the learning outcomes. One of the key things we wanted to do as part of this was to encourage the implementation of a digital health passport. This ties in with one of our LEAP project aims to increase sort of digital learning and use of digital skills. So it sort of came in on a number of levels, and that was something that also came through our work with Wilford Trust that identified that patients weren't aware what one was or they didn't know how to get one. So it was something we really wanted to focus on implementing with our students implementing as part of their project. And then we also made sure we created a workbook which strengthened the understanding of the long arm approach. And the idea of it was to maintain safety, to make sure that the students have got a book that basically is prescriptive to keep them safe, in that the expectations of the assessor, the expectations of the student are all in there. And things like, for example, having red flags, I think I'll come on to it in a minute, but having some of the red flag things identified. These clinics had to be safe. So the students knew that they could only see patients who were well. If a patient was unwell, that was a red flag, and that could be directed to a different clinician. And it was setting those boundaries basically at this point in time. Excuse me just 1 second, I'm really sorry. Right, there we go. Next slide, please, Hanan. So the third stage, timetabling and then more training. So we identified, we came up with a timetable with including the hub and spoke, and tried to make, so that it wasn't monotonous, it was all broke down and in stages. We worked more closely on these red flag situations to make sure we came up with any what ifs. What if this happened? What does the student do? What if this happens? And created within the workbook a plan, so the student knew, like a flow chart, they knew exactly what to do in those situations, so that they never felt out of control in a situation. And as to the assessor knew exactly what the process for dealing with any of those things was. We also made sure the students were trained using the particular system that their GP practice was going to be using. So one was using an EMIS service, one was using System 1, and we made sure that they were both confident with the use of the SBAR system for communication and debriefing, so that as part of their daily routine, it's stated in the workbook that they had to have a debrief at the end of every clinic with their assessor or with a supervisor. And the use of SBAR in there was really important to make sure it was structured and effective. And we wanted to make sure that we had these clear outcomes, what we wanted to achieve, which Debbie has touched on, from the students delivering these clinics, but also be really clear for the student what the aim, like we made sure they fully understood what the aims of an annual review for someone with learning disabilities was about, what the purpose was, what the aims were, and that it wasn't just a tick box exercise that it can sometimes be, if we're honest. Next slide, please, Hannah. The fourth stage, visibility, support, and capturing the narrative. We did this in the planning, but this actually came to fruition during the actual journey of the students being out on placement. So this was us being visible to the staff and the students, especially at like those key points, the initial, midway, and final interviews. It's about, we got the students to do a reflection every week. They did a key reflection on their experiences of that week. And this was to help us understand and see where they were going with their experience and their development of confidence and self-efficacy going through it. We used Padlets as a means of communication with them, so that they could jot all their work, anything that they were doing, and notes about things would be kept in the Padlet, and we could use those to, again, use it to make sure that when we were meeting up with them weekly, in our weekly check-in, we could focus in on anything that's in a bit of an issue that week for them and help identify the learning that's going forwards. Next slide, please, Hannah. So the students went out for 10 weeks. They did their placements, they did their spokes, and then we're now planning a celebration event to basically celebrate those students and the achievement that they've made. And the idea is of this event that we're running at CU Scarborough is to get everybody who's been part of this project all together to see how their small part in the project helped create this massive project, and how that's helped the girls and some of the assessors develop this confidence as a result. There is a link there. I don't know if when you get the slides it should work. So if anyone would like to come, you're very welcome to attend that event, and it gives you a really fuller picture of exactly what we did during the event, and some of the assessors and the students will be talking about their experiences as a result of everything that we've done. Next slide, please, Hannah. And then so the last bit really for us on this part of the project is research and evaluation. So this is where we are evaluating this pilot project using a hermeneutic phenomenology and research approach. We've interviewed the participants. We got ethics approval, just to be clear. We've interviewed the participants of the whole project, and we've looked for key themes that have come through regarding this student-led clinic placement. And we're now in the final stages of writing that paper, and we're going to be presenting it at the RCN International Conference in September in Manchester, and hopefully we'll get it out in publication sometime soon. I will now pass you back to Debbie to do our summing up. Thank you very much.
Thank you, Gemma. Thanks very much. I just wanted to probably have a look at, as this is the emerging role, is what Gemma and I found from our experience, because there was no probably very clear job description at that point, except the output that we needed to probably do. But thankfully, we've had an impact, which is great. So I just wanted to share a slide with you of what we did find. Hanan, could you give the next slide? Well, in a little jokey way, Gemma and I found that we were rather a bit Heineken, weren't we? And we were refreshing the placements that others couldn't potentially reach. But here was something that we did actually find, that we were embedding education and research and development and standardisation very much across the primary care settings that we came across, and a lot of people that we did have to talk to. We did open up and support more placements within primary care settings in accordance to the LEAP programme. We've managed that relatively well, and we were still ongoing with that. There was a lot of mentor and coaching that we did for staff. And evidently, as Gemma previously said, we introduced an app, a digital app, to help with the annual health checks, those that wanted to load it onto them. So it was something that was portable and transferable. And that went down quite well, actually, with some of the patients, and also our partnership with Wilf Ward. We managed to disseminate some new aspects of practice, particularly some of the models that we undertook as well too, and how they could be integrated. And we felt that we were an outreach service for some of the PCNs, and we weren't sort of boundary driven by that as either at all. So we were more mobile and independent, and we did feel as with the practice educational leads is that we could be quite complementary to that as well too, because we're a little bit more fluid by going out from the boundaries of other PCNs. So that was us, really. And then just to sort of recap, next slide please, Hanan, is what we are very much finding is these were the key aspects that we wanted to probably share with you, is that by running a third year LD student-led clinic, you need to have good preparation is required so that everybody is involved. And as like Gemma said, all the safety aspects that are in place. We have found that the fact it has alleviated the workload for the QOF, it has. We do know that it has increased confidence and autonomy and role identity, not just for the student, which is what we aim to do, but also for the assessors and other supervisors as well. So there was a good motivation there, and it's enhanced some professional development as well. Our feedback from our partnerships, and particularly Wilf Ward, we are finding that there is better high quality patient care and evidently well-being for everybody involved. So I think that is one more slide to go, just as to give you a bit of a takeaway, is that in this instance, the long-arm supervision model was very successfully implemented. It was for our healthcare trainees. It was, as a lot of you have already indicated, that an integrative approach to supervision is very helpful and complementary. But as we found, we had to very much look at the environment of where we were placing students in particular, and deal with our partnerships about what they could achieve, because evidently there were limitations, and one being was the infrastructure. You know, when could they hold these clinics in primary care, because they have quite a lot of infrastructure issues. But we were successful in enhancing that learning, fostering confidence and self-efficacy as well too. And it'll be interesting to see how the students progress once they are qualified. And just to leave you with placements, you know, within and beyond the NHS arena, you know, will provide students with innovative opportunities to learn and communicate effectively within individuals, as Hanan said right at the beginning, right across everyone's lifespan. So thank you ever so much, everybody, for listening to Gemma and I and allowing us to share this with you. Those are references. We appreciate your time. And I think we'll probably be open to questions. We will be now, will we not, Hanan?
Yeah, thank you so much, Debbie and Gemma, for sharing your journey and experience in slides, and highlighting the positive impact of such an initiative to our community, including our learners and the practitioners. Well, we agree that the workforce are all learners to start with. We are so pleased to be at this stage where we're happy to take further interest in this application of students leading integrated care environment, SLICE. And this is brilliant timing to introduce you to our placement coordinator, Claire. Claire Pembleton has been recently appointed as our placement coordinator, and will be leading and supporting our partners in such an initiative. Claire's got her cameras on. Claire, can you tell us a little bit about what your role is going to be and introduce yourself to the audience. And after that, we will be opening to the questions. So.
Yeah, hi everyone. Thanks, Hanan. So yeah, my name's Claire Pemberton. I'm the very newly appointed placement coordinator for Humber and North Yorkshire ICB. The main element of my role is to support placement expansion within the private, independent, voluntary and care sector. And that includes hopefully reaching out to charities, primary care, care homes within local councils. We've recognised that we have lots of health and social care students kind of all bottlenecking into secondary care at the minute, and we really want to utilise voluntary and charity sectors to offer more placement opportunities for our students. So I've just started by reaching out to the 4 main higher education institutes that we work with, and that's York St John, Hull and Coventry Scarborough. And just kind of opening up conversations with them to begin with, to see where their gaps are. So far, Coventry Scarborough have come back to me and said that they're really struggling with LD and mental health nursing placements. So that's kind of where I'm going to channel my efforts for them. And as I continue to get more feedback from the other HEIs, I'll take their lead really. So it's really exciting. I'm really looking forward to getting stuck in, and hopefully we'll have a really good catalogue of new placement opportunities for our students going forward. And this is just a couple of QR codes here, guys. If anybody's interested in connecting with myself or anyone from the SLICE team, you can scan the orange one. You can also click on the link there. And if anybody wants to give us any feedback, you can click the link for the purple one or scan that QR code.
Thank you very much, Claire. We will keep the slide on for people to click. You can click on the link and fill it later-wise. It doesn't matter, or the QR code using your smart mobile. Yes, the orange is to express interest in the SLICE initiative, and you think that you would like to apply it, and we might help you with that. And the other one for the webinar feedback, please do. We thrive on feedback, and we always would like to improve on it. I think it's a brilliant time to move into some questions that I've been observing through. Is that okay, Gemma and Debbie? So we've got questions. Could I please ask what the 2 hubs were in Humber, North Yorkshire?
Right, Deb, I'll do it.
That one. Okay.
Yeah, can do. We had 2 GP practices. One was in at Driffield, Cromwell Road, and the other one was in Scarborough, which was the North Yorkshire one, which was West Ayton. So they were the 2 GP practices that we managed to have as the hubs.
Thank you. For part 3 LD learners, I have found AEs requiring PA, who is a learning disability specialist. I can see SSS says PA needs to have equivalent experience in field, but cannot see where it is stipulate field specialist registered specialist. Are you able to say where this is documented?
No, I don't think
No,
we can.
sorry.
No, sorry. Not sure on that one. Sorry.
Okay.
Apologies there.
No worries. This is a fabulous work. We piloted a similar pathway within one of our PCNs in Wigan and hope it runs. So this is not a question, as a comment. That's fine. Outside the NHS environment, MySpecs Nurses is happy to champion any learning opportunity. That's another voluntary services for you, Claire. Just trying to scan through any other questions. Have you any information on the development of the annual health check app to share?
Yeah, we have got that. Do you want to answer that one, Gemma? Picking it up from Portsmouth?
Yeah, can do. I'm not sure if that's what you're asking for. You're asking for the annual health check app. If you're talking about the app that we spoke about, that's the hospital passport app. I'm not aware that there is an annual health check app out. Our girls used, there's templates already out there for the annual health review when you're having them. And so the girls used those to create their own consultation, if you like, to make sure that they hit all of those things in the annual review when they were doing the annual reviews. And as part of the celebration on the 19th of June, we'll have all them on display at the university. But if you're asking about the hospital passport app, that's the one that that we use. We've adopted the one that was developed for Plymouth Hospitals Trust. It's a free app that anyone can download, and I would probably argue that we all should have it, not just people with a learning disability, because it's really simple. It basically helps identify what your key wishes are for certain things, what's important to you, and I'm happy, if anyone wants us to share the link for that specific app with them, yeah, I'm happy to share that, not a problem. I would argue that we should all have it, to be honest. I hope that's answered your question. Yeah.
Thank you. Okay, do you mind this is thank you for sharing this interesting work. I wonder if you might please share a few snapshots of the feedback students provided you after the clinics without too much spoilers of the conference presentation, of course.
We'd have to get the Padlets out probably, because there's lots of this is why we had a Padlet, and we brought the students in once a week so that they could have a debrief about it, so we knew that they would be supported. Yes, we have analysed a lot of their comments as well too, and we're very thankful that they are positive. One we could say, and probably to be aware about, is that one student did indicate, and has actually highlighted that in their interview, is that being aware about undertaking these annual health checks, you don't want to exhaust the student by it becoming monotonous. And I think for one student who had quite full clinics, found that quite a strain after a while, and it was good to step out and have the spoke placement in order to consolidate that learning, which was pretty good. So it helped them to consolidate it and then transfer it somewhere else. And I think that was really good in terms of the fact you didn't have somebody sitting there 5 days a week utilising all of their placement hours, just doing that day in and day out. So that's something to be aware about, in light of that.
So I've got another question for you. Where all the PAs, the practice assessors for your learners, learning disability practitioners? Are they all LD practitioners?
No, they weren't, were they, Gemma? They weren't. They were adult based GPNs and ACPs. They were. So no, and this I think is something that was quite surprising, really. There was a care coordinator who was LD background, but we came across no assessors in primary care who were LD trained.
And then we needed to put a bit of support in with the general practice staff regarding that, because there was some apprehension because they weren't LD trained. It didn't take an awful lot, if I'm honest, but it was just that apprehension initially of, oh, it's very different. And one thing that I think was really great to come out of the whole placement was that the students that are learning disability nursing students came out with some amazing physical assessment skills that they'd never touched on before, because they've always had learning disability specific placements, whereas this was a mix of the two. So that was something really positive that came out of having these assessors that were adult trained and mental health trained rather than learning disability trained.
Yeah. I can't see any further questions, but I don't know, I can't see any hand raised for anybody who wants to ask anything. Okay, can we discuss this another day? Read the PA not being LD practitioner, as this is where I am struggling with for part 3 learners. Thank you. Yeah, can discuss this outside. I am aware that the disciplinary as a nurses has been assessing different disciplines. You don't need to be a mental health nurse to assess a mental health trainee, or sometimes it's just nurses will be adequate trained ones. So another push for feedback, please, because I've just checked and there's no feedback yet. So, so please do a link, click on the link and give us your feedback, or scan your QR code. And same thing if you're interested in a follow-up following this session to review your areas if you're interested in this initiative. And we're happy to do physical visit to try to support you with developing similar initiative within your area. So this is when you say you can ask your local LEDER team if they take students or send them to us in Sussex. This is Sussex. We have no LD students. Okay. So any final comments, Debbie or Gemma, before we maybe close the webinar and give people back a couple of minutes?
No, not from me. Just to thank them very much for attending. Really appreciate it. As I said before, I know time is a very expensive commodity now. So thank you very much for allowing Gemma and I the opportunity to disseminate what we have found from this pilot project.
Seconded. Thank you very much.
Thank you both. Thank you both for being initiative, that lovely, positive, inspiring initiative that you've done. Well done. And looking forward for the event of success and celebration. Thank you very much.
Thank you, Hanan.
We've got a hand up from Sarah. Sarah, do you want to come in?
Only me, just to say that Nicola has identified that some trust PCs are blocking the link that you've embedded in the feedback form. So for people to use the QR code using their personal devices if they want to give feedback. Thank you for raising that, Nicola.
Thank you. It's good to know. We will follow as well with an email around 2 weeks from today with all of the recording and any additional information that would be useful for you. Thank you very much for attending. Until we meet you next month for our next LEAP webinar. And that's another brilliant story that you look for social media and find the links to register on it. Thank you very much.